Hi. Have you been trying to conceive but still have had no answers? Discover what most fertility tests miss. Fertility struggles aren't always about age or timing. Often it's something deeper, such as genetic factors, hormonal imbalances, or even inflammation. Getting the right test can uncover it. So if we're looking at genetics, we're looking more at certain variants or polymorphisms, or what they're called. And when those occur, some of them more so than others can impact your hormone production, your egg production, even sperm factors can take place and make things much more difficult to try and conceive. So we want to make sure we're getting really good aspects or help when you need it for those kind of variants. And the only way you can do that is if you know if you have them or not. So basically, if you have the genetic screening done, they'll uncover if there are any issues, and that can help give some very helpful or crucial information so that then you can take steps for helping those variations. And so if we're looking at certain ones, usually they'll target specific ones that have more to do with or could impact fertility. So MTHFR is one that more people I think are common with, which is the methyl tetrahydrofolate reductase, quite a mouthful. And that can definitely be impactful, especially when it is on both sides of the family. So if your mom and dad both have it, the genetic variation, then you have more of a proclivity to have the factors of that variation. And usually what it means is that you're not able to pick up and utilize folate as well into your cells. And a lot of the prenatal vitamins that are out there will usually have folic acid in it, which is a synthetic folate. And that one is not as easily broken down and utilized, especially when you have this type of variant. And so you have to kind of find out which version of folate is going to be best for you, because when you do have a MTHFR variation, it's not always cut and dry that a MTHFR type of folate is going to be the best one for you. And there are some different types, different binders that go with a folate that can be received better by one person, maybe more so than another. So you might try one and go, well, this doesn't work for me. It's making me feel different. And so then you look into a different one. And sometimes it depends on the specific type of variation you have with MTHFR. This isn't to worry you. It's just letting you know that if you do have this variation and you're not uptaking folate, it is one of those vitamins that is needed throughout the body. All your vitamins are necessary, but with the B vitamins, they do a lot cellular wise and helping your system work more effectively all across the board. But since we're talking about reproduction, we want to make sure that that is taken care of, that that's going well. So that's one thing, is the methylation. And it really is important for reproduction, especially with it being like what they'll call as homozygous. When you have it on both sides, both your mom and dad have it, your chances are much greater that you'd be impacted by having that variation and more needful of having a good folate. Otherwise, there are also other factors that they'll want to look into. If your doctor's willing to do some testing on you in this manner for some of the basic genetics that show up and can cause issues with fertility. The other one is like factor von Leiden 5, I should say factor 5 Leiden, and it is more about clotting factors. So if you tend to have a history with painful periods and clots, it might be beneficial just to check and see if this is a factor for you or not, because the problem with having too much clotting or stickiness in the blood, then it doesn't help blood flow as readily to the areas that you need it. And when it comes to reproduction, you want to know that you're getting good blood supply to the uterus, and then to having a good lining that also is part of it. And so the more the good blood flow is getting into the uterus, it's going to help that buildup of the endometrium for implantation. And it's also going to help the placenta when you do have implantation to make sure you're getting good blood flow and supply to nourishing, a growing fetus. So that's another one that's important to look at. That's one clotting factor. It's not all of them, but there's several others that you want to make sure are not a problem. And this is something you want to have your partner do as well, because if they have the same kind of variance you do, then they need to make sure that they're also taking care with whatever supplements are going to be more helpful for that, as well as diet. Diet can also be impactful for some of these variants, and so you want to be watchful there. And for more information on that, you can always message me, because I'm not able to get into as much detail on that part of it right now, but there are definitely ways of eating that can make things less sticky as far as the clotting factor. And of course, getting good folate, you're going to get good folate if you're eating the right foods, the right vegetables, getting more leafy greens in, and your meat also is higher in those B vitamins, and it's not going to be a synthetic, it's going to be a natural folate in those cases. So you definitely can use diet to make things better there. The other thing I wanted to talk about is chronic inflammation, and that's tricky because we don't always think of it that way. If we're having gut-related issues, or if we're having joint issues, or if we're getting more headaches or neck pain, or different factors in our body that could be pain-related or not, but there usually can be an inflammatory factor that's going on there. And so if that's happening internally, not just in the gut, but maybe even reproductively, we're looking at things more like with fibroids. Sometimes they'll cause pain depending on where they're located. And with PCOS, depending on how many cysts are current in the ovaries, that can also cause discomfort. But the other thing is endometriosis. That's a big factor for causing more inflammation. And depending on the level of it, sometimes you can have a minor case of endometriosis or an endometrioma, and maybe it's just in one area. And so you're only feeling some discomfort in that one area. But if you get more of a pervasive, like where it's more in many different areas of the abdominal area or sticking to the GI tract, then usually you'll have more discomfort over a diffuse area, which makes it more hard to tell if it's a reproductive problem or if it's a GI issue. So gastrointestinal stuff, a lot of times if you have celiac, or if you have any others, IBD or inflammatory bowel disease, any of those things can also cause a lot of inflammation or pain. And so if you're experiencing that, you may not know that there could be actually endometrial tissue that's causing the inflammation and pain. So because it can stick anywhere. And especially if it's near nerve tissue, that's usually when you feel more pain. I've seen people before, or women before, that have had endometriosis and really not had much pain at all, but they're in the lower percentile. So if you are having more painful periods on a regular basis and you're trying to get pregnant, then that is something that's really worthwhile to have them check for. And so seeing your doctor, you'll have to get a prescription, or them sending you to a place to be able to get that looked into. Men can also have a lot of inflammatory aspects that could impact their fertility. And so having them checked as well, typically they'll go in and get, potentially hormone testing, sperm analysis, hopefully a good one. And that can give a lot of information right there. But if they haven't been checked for, especially if they have any pain at all or problems with ejaculation, that could be a sign of inflammatory factors happening for them reproductively. They don't always give that information unless they're pretty vocal with you about those kinds of things. But you want to make sure that that's not an issue. When they do the hormone check and they do the sperm analysis, they might see some things that are off enough to do further exam, which is what you want to do, is you want to check and make sure there's no problems with prostatitis, that there's no problems with a varicocele, which is a varicosity right in the testes. And so when those are there, it's not always where it causes a lot of discomfort. It might cause some with ejaculation, but it's more of how it warms up sperm and can damage it. And you definitely want to avoid that. We want to have enough good sperm count. And so that's one of those things that can be worked on with herbal medicine, and also some with acupuncture and some other care can be done for helping a varicocele, actually, and prostatitis too. It's just more of like, once you know the information, then it can get treated. It's just the knowledge that you have to gain first. So with chronic inflammation, it can also disrupt ovulation, and embryo implantation can also be affected if there's too much inflammation going on. And as I said before, sperm production for male. And so getting those tests done is really, really important. The other thing I wanted to talk about is the environmental toxins too around us that we're getting in daily between food, air, and water are also impactful for causing more inflammation internally. And so if you know you have problems with mold exposure, or you feel like your allergies are getting worse all the time, that maybe the histamine levels have reached higher points, it's really a good idea to maybe do something that's more of an environmental check. Because if you do find that you have an increase in those levels, there are things you can do to try and help get your body more cleared out, or some detoxing or clearing those out of the cell level so that your body can work and affect more effectively. The last thing I wanted to mention, though, was insulin resistance. And that is one that, if insulin resistance, you're usually looking, a lot of people, they'll get a glucose test. And if it gets higher, glucose can go up and down all the time. You can check it every other day or every day, and you can have a different level, even fasting. But when it comes to your hemoglobin A1C or HA1C, that is a marker for insulin resistance. And you really want to see your levels below 5.4. Western medicine usually lets you get up to 5.7, but if you're really trying to keep your blood sugar and your insulin at a good level, you want to keep it below 5.4. Like 4.8 to 5.2 is actually great. But with this, if you're seeing it ticking higher, that can definitely cause more problems with being able to conceive. So looking at those levels is important, because with insulin resistance, it's a step before diabetes. And so you're wanting to kind of watch that. And especially if you have family history with insulin resistance, then you really want to make sure that you're making some changes in your lifestyle. I know sometimes I have patients say, like, the doctor keeps telling me to lose weight, but they don't tell me anything to do about it. And so dietarily, you really do, if you're finding you hold a lot more weight, if you've been diagnosed with PCOS, then you do want to work on more of an anti-inflammatory type of diet that is lower, definitely lower in carbs and sugars, and being really mindful, cutting out things like alcohol and anything that is more fattening. No, I don't say fattening, but like the carbs and sugars are probably the biggest thing. So try and limit those as much as possible. And it's hard because we like what we like, and stress also can make us want to eat some of these things. And so stress reduction is also really important. There's tons of things that can be done there, but I would definitely say laughter therapy, breathing techniques that will help get you more into feed and breed versus fight or flight. And so I know I've talked about that in some of the other videos I've done, but that's really important, is to find ways to reduce stress and then change your diet, and those together, and also lifestyle wise, getting more movement in, make sure your lymph is moving, that you're getting some sweat going, and that also is good for helping your lymph and detoxing. So that's really important. And so more women with PCOS often have insulin resistance factors that start going on. Males also can have problems with insulin resistance that will impact their fertility. It disrupts the hormones, and it also can disrupt reproductive functions. So as I said, hemoglobin A1C can be tested, as well as fasting insulin. So either way, you're doing a fasting test. So first thing in the morning, make sure you fasted for at least 10 hours. Water is okay, it's just no food. And then, as I said before, especially if it runs in the family, it's a good thing for you to check. So if you're ready to get some answers to some of these questions you've been trying for a while and you're getting pretty frustrated, I would say join the Pathway to Pregnancy program that I've created just for you. It uncovers the root causes that keep you from getting pregnant. So we do a very deep dive, really looking into the blood work, the diet, your history, all the things that have been going on with you that could be pointing in directions of inflammation or toxicity or blood sugar dysregulation, or just whatever reproductive system symptoms that you have going on can be very telling. So then you know what tests might need to be done to really give clarity, and then plus have a plan in place. So I would say definitely look into the program, and then stay tuned for more videos on other issues that may be impactful that you need to know about. Have a great day.